Diversity and inclusion matters enormously in global health. Historically, we have seen a lot of the leaders, and we're certainly standing on their shoulders. These giants that have affected change in global health have often been from medical backgrounds. They've often been academic. They've often been Western. And while we've made tremendous strides in global health, it is critical to acknowledge that change makers come from everywhere. Global Health Corps is a community of young leaders who are passionate and committed and obsessed with solving global health issues. Ultimately, they're problem solvers. Everyone that joins Global Health Corps is 30 or under when they become a fellow. They come from 16 countries. 50% of them are from East or Southern Africa. They speak 42 languages. And this diversity that we have amongst our community is critical to us.
As global health leaders, we always face challenges, and these challenges can be professional, they can be personal, and they can be system-related. I'm going to invite you to think about one challenge that you feel that you are facing.
I see Global Health Corps not to solve the quantity problems, but to solve the quality.
So the challenge I find very critical is breaking the silence around talking about sex and reproductive health.
Bureaucracy. People don't want to change the way they're doing things.
What it takes to change a system is, first of all, we need leaders to lead that change. We need people that are convinced that health is a human right. We need people that are convinced that it's not the money you invest in the health sector, it's how this money is equitably shared.
We are following cases of chronic disease. We are also having cases of cancers, malignancy.
Ever since we started, when we met with organizations that we'd partner with, they told us their biggest gaps. And what was most exciting to us is that they were requesting systems thinkers, they were requesting architects, they were requesting those with finance backgrounds, which meant that we could open up the field to young leaders who might have been passionate about global health but didn't see how they fit.
In our office, we believe architecture and buildings represent physical manifestations of the underlying systems in our societies. So that spans from health to socio-economic systems to political and power systems. And to extreme examples, we've seen badly designed hospitals literally killing people.
This building you see here is the neonatal intensive care unit, which has been a flagship building in this district, actually in the whole country. Because when you look at the aeration of the building, which is very, very helpful in terms of infection control.
That said, we believe that our job, our profession's ultimate outcomes are to enhance for health and equity. How do we make sure that infrastructure helps achieve those goals, rather than just filling the space.
We work with our Global Health Corps fellows. We do a lot around systems mapping. We do a lot around understanding your role in a system, both big picture and then getting granular into your day-to-day. And really understanding if you can move a system, you can serve so many more people.
No, so I remember that was really helpful at Q1.
It is critical that our fellows and our alums have comfort working across cultures. And so from the very start, we started with a co-fellow model. Our fellows always work in teams of 2, and they're always from 2 different countries. We have about 1,000 young leaders who work across borders, across systems, across countries, collectively, to make an impact on the issues that they care about. We see them banding together in Uganda, using their strength and power and numbers to affect change in maternal health. We see them banding together in Zambia with the Ministry of Health to affect change and strengthen primary healthcare systems. No matter how bad their day is, and days in global health can be pretty bad, they know that they have almost 1,000 other people standing behind them and standing aside them doing this work together.